Physician-assisted suicide has recently been put in the spotlight. However, it has been a controversial issue for quite a while.
Physician-assisted suicide is when a patient who has a terminal illness receives medication from their doctor that will end their life in a more peaceful way than the illness would.
It's the law that allows doctors to prescribe lethal doses of medicines to people who are within 6 months of dying, who are terminally ill.
Dr. Jack Kevorkian was a doctor who helped terminally ill patients end their lives before it was legalized. This caused a lot of controversy on this topic. However, Kevorkian continued to do what he believed in. Because of Dr. Kevorkian, physician-assisted suicide has become legalized in a few states such as Oregon and has been considered to be legalized in others.
Suicide. It's not a right. It's in here. Everyone can kill himself. Or herself, sorry. To ask assistance to do it is not a right either. That obligates somebody else. But a person can voluntarily exercise autonomy and say, I will help you in an action to which you are entitled. The problem is infringing the autonomy of the person who wants to actively help without being asked or forced or coerced or feeling that he has an obligation to fulfill. See, this is the problem. The laws prevent that. That's an infringement of autonomy that cannot be justified.
Physician-assisted suicide started being discussed a lot more after 29-year-old Brittany Maynard made a big decision. Brittany was diagnosed with a terminal brain cancer and decided to move to Oregon with her husband so she could use the Death with Dignity law.
And so I think that having somebody like Brittany and her story be out there, it's on the cover of People magazine, these are things where it's probably getting to people who probably don't think about it that much. So whether it's changed the views in terms of someone saying yes, you know, thinking no before and now thinking yes, I'm not sure. But I think it's definitely probably had people just thinking about it more and kind of delving into their own decision making about it or thoughts about it.
There are many ways that people look at physician-assisted suicide. Many people think that someone should have the right to die on their own terms instead of suffering at the end of their life because of an illness. However, other people believe that physician-assisted suicide is morally wrong and goes against the oath of medicine, stating that medicine should heal the patient who needs it.
I don't think it goes against the oath. To a certain extent right now we already have basically what I would call a passive assisted suicide by the fact that we make decisions about giving more medications than we give to somebody who wasn't having a terminal illness. Or we take away things, we take off ventilators, we stop feeding. Those are things that we're in some ways passively helping these people pass away. So I feel like to a certain extent we do it already, and the end result is that we're truly helping the patient suffer less. So I don't think it goes against the oath.
My name is Silverman. In 2009, I was diagnosed with stage 2 breast cancer. I did 6 rounds of chemotherapy, had a mastectomy, and a year of a drug called Herceptin. Only 4 months after I finished all my treatment, which took a year, cancer was found in my liver. Breast cancer that moves into another organ is considered incurable at that point and is terminal. Most people with liver involvement live about 2 to 3 years. So after that point, I done 7 different chemos. I had half my liver removed to try to control the cancer. It grew back. I had gamma knife radiation on my liver, and it still grew back. And then a new drug came out called Bryanna, which they put me on a year ago, and that cleared everything up, and I'm in a remission now. being as sick as I've been, I've had a lot of time to think about this. And my personal opinion is I would never do it. I mean, I have taken advantage of a drug that wasn't out when I was diagnosed. So far, very few people have been put on it, and it has given me years that I wasn't going to get before. So even though I think that not everybody is going to have the kind of luck that I've had, I still think you never know what's going to happen in life, and you don't want to take that chance away from yourself. That's my personal opinion. I wouldn't say anybody else would have to think the way I think.
The Death with Dignity law is only in action in 5 states as of right now, including Oregon, Washington, Vermont, New Mexico, and Montana. This law is coming into effect in more and more states. It's only a matter of time before physician-assisted suicide is legal in our community.
This could cause a lot of deaths in our community. However, physician-assisted suicide can also make it easier and less painful for patients with a terminal illness and cause less pain in our community.
However, some people argue that if the Death with Dignity Act is effective everywhere, then people might abuse this law and use physician-assisted suicide when it isn't necessary. Shouldn't terminally ill patients in each community have the decision to end their
Or is
lives?
each community better off without this law?